Hello, my name is Alice Bird and I am a Consultant Obstetrician at Liverpool Women's Hospital. It has been great to hear about how well the vaccine rollout is going, particularly now that this routinely includes pregnant women. Although the initial vaccine trials did not include pregnant women, we now have real-world data from the United States where approximately 90,000 pregnant women have been vaccinated and there have not been any safety concerns raised. This means that all pregnant women should now be offered the Covid-19 vaccine at the same time as the rest of the population, based on their age and their clinical risk group. I have been asked to answer a number of questions that you may have in relation to the Covid-19 vaccine and pregnancy. Is it safe to get pregnant after you have had the vaccine? Current advice is that you do not need to have a pregnancy test before vaccination, and that women planning a pregnancy, including treatments such as IVF, do not need to delay pregnancy after vaccination. There is also no evidence that the Covid-19 vaccine causes miscarriage. Will the vaccine cause side effects that can harm my baby? The Covid-19 vaccines do not contain any ingredients that are known to be harmful to pregnant women or to a developing baby. The vaccines that we are using in the UK are not live and so cannot cause Covid-19 infection in you or your baby. This is similar to the flu and whooping cough vaccines, which we routinely offer in pregnancy. Given that Covid-19 has more serious complications in later pregnancy, some women may choose to delay their vaccine until after the first trimester. What about blood clots? Is it really safe to have the vaccine? There have recently been reports of rare but serious blood clots after vaccination. It is not thought that being pregnant increases the risk of this. However, because the side effect is so rare and has not yet been reported in any pregnant women, we do not know the exact risk in pregnancy. The JCVI has advised that pregnant women should be offered the Pfizer or Moderna vaccines, as these were the ones used in the United States. The decision about whether or not to have the vaccine is yours. It is important that you understand as much as you can about the vaccine and also about the impact of Covid-19 in pregnancy, which will help you to make that decision. We will signpost you to some useful resources, and if you wish to discuss this further with a healthcare professional, this can be arranged.